Matthew Perry's cause of death. Former medical examiner explains how Friends star may have died. Perry died of an apparent drowning in a hot tub over the weekend at age 54, law enforcement. The cause of Matthew Perry's death has been deferred by the Los Angeles County Medical Examiner coroner, leaving a grieving public wondering what happened to the beloved Friends star. The Los Angeles County Medical Examiner coroner on Sunday told SSN 24 News Digital, an autopsy was completed today, and toxicology results are pending. As the public waits for answers and mourns Perry, Dr. Michael Baden, former chief medical examiner of New York City, forensic pathologist and SSN 24 News contributor, weighed in on possible causes for the Friends star's untimely death. "I think from the information that's been released, we won't know until the toxicology is performed, given his history of problems with alcohol and drug abuse. But the fact that he was found in a hot tub raises issues immediately about drowning or even heat stroke," Dr. Baden told SSN 24 News Digital. "Usually the toxicology only takes a few weeks at most, but they may be intending to do more than the usual toxicological examinations," he said, adding, "Often, when there is a great interest in a death, there's delay to do a more extensive toxicology than normal." Perry died Saturday after an apparent drowning in a hot tub at his home in the Pacific Palisades area of Los Angeles, law enforcement sources confirmed. Drugs were not reportedly found on scene and no foul play is suspected. In an October 2022 interview with the New York Times, the actor said he had been sober since early 2021. "On the basis of the information released so far, it is certainly possible that he could have died of natural causes, especially given his history of surgeries and medical emergencies," Dr. Baden said. "A natural cause of collapsing in a hot tub, even from heatstroke, let alone drowning, is a real possibility. And given the fact that if he had damage to his brain or heart in the course of the prior comas that he's had after surgery, that would make him more susceptible to drowning." Perry was 54 at the time of his death, and detailed 2 near-death experiences in his 2022 memoir, Friends, Lovers, and the Big Terrible Thing. Perry wrote that in 2021, his heart stopped for 5 minutes when he was anesthetized before a planned surgery for back pain in Switzerland. In 2018, Perry underwent a 7-hour emergency surgery after his colon burst, and following the incident he was hospitalized for a total of 5 months and was in a coma for 2 weeks following the surgery. The previous surgeries he's had and the previous history of coma following surgery would indicate that he has a higher risk of a cardiac event that can happen if the heart was affected by the coma episode, Dr. Baden said. Also, he would be more susceptible to some sort of a stroke because in a coma and cardiac arrest, some brain damage can occur. And this may not manifest itself depending which part of the brain is involved. But it would make one more susceptible to dying from a cerebral stroke with the added risk factor created by the prior cardiac arrest episodes. Perry reportedly played pickleball earlier in the day, but Dr. Baden doesn't think the sport had a direct effect on his death. It would be unlikely that pickleball had anything to do with it, except that he may have played pickleball and then decided to take a break in the hot tub. And the heat of the hot tub and the heat from physical exertion could be additive and cause not necessarily death, but could cause him to pass out or go to sleep. And if you passed out or go to sleep on a bed, you're okay. But if you pass out or go to sleep in a hot tub, you could drown, he explained. Perry's last Instagram post showcased an image of himself wearing headphones in a hot tub at night. "Oh, so warm water swirling around makes you feel good? I'm Mattman," he wrote in the caption. "The heat of the hot tub is like the heat of heat stroke, and somebody standing at attention in the hot sun can keel over if the body temperature rises too high," Dr. Baden said. "If there's a lot of heat impacting on the body, it can raise the body temperature, especially in people who may have compromised immune systems or medical problems." Hot tubs and jacuzzis, like any body of water, also raise the level of risk for any individual, especially if they're alone. There is a danger if one is alone at home in a bath or hot tub, if you pass out, if you lose consciousness for any reason, if you're tired or because you have a slight mini-stroke or something, said Dr. Baden. Whereas if you're not in water you can recover, but in water, then you're going to run the risk of drowning and then passing out, and having a sudden loss of consciousness can happen to somebody who's had the kind of multiple surgeries and post-surgical episodes that he